Okay, so
Yeah, what was our question again? I forgot.
I think our question is why therapy won't work.
Oh, yeah.
Yeah.
Well, okay. There's one answer that's very easy and obvious right off the bat. And it was amazing. I was just at a conference and somebody raised their hand, and it was exactly, I must get this phone call once a week. And it
Mm.
was a mother who was concerned about her kid and telling me all about, the various addictions and whatnot. I think there's a little bit of abuse going on. I don't recall. It was a very public forum, so she was going through some details, and I was kind of hurrying her along. But lo and behold, at the very end, I have to ask the question, so how old is your son? Well, he's 27. It's like, well, I
Yep.
can't I can't go arrest him, drag him into my office, tie him to the couch, and make him do therapy.
Yeah.
That's not an option. I mean,
Yep.
maybe some version of that was an option once upon a time, but
Mhm.
not today and not in California. So the fundamental answer is, or the first of many reasons why therapy won't work, is you got to be willing to engage in the process.
Mhm.
I
Yeah.
mean, without that, that is the sine qua non of
Yeah.
therapy.
And I
And I'm
guess
sure you get that kind of phone call too all the
oh
time.
yeah, yeah. A lot of moms and a lot of sons that need to be fixed or fathered.
Yep.
And it's true, and it's hard, hard family dynamic sometimes with this, especially if there's a dad not in the picture. But yeah, that piece of motivation, interest has to be there, which kind of goes, I think before we jump into that more, my question is, what do you think are the assumptions people make coming into therapy? Whether it's the client themselves or the mom that's trying to get their kid to go to therapy. Um, what
Yeah.
people are assuming.
Well, hmm. I think so. Yeah. Once you get past the, I'm willing to walk into your office and actually do this, whatever this is, there are a whole lot of assumptions surrounding the question, what is it we're going to do here?
Mm-hmm.
Um, and some of those assumptions are culturally conditioned. Some of those assumptions are um, kind of surround the popular mythology of what psychotherapy is, the kind of Fraser Crane version of psychotherapy, which, is mildly delightful. Or I guess there was that HBO show, In Treatment, which
Mm.
I think does a better job of, I mean, it suffers from the same problem bad therapists suffer from. We deal too much with the therapist's personal life, right?
Yeah.
So that might be another thing to put on the list of why therapy won't work. Apart from the assumptions that the client brings, there's also the behavior of the therapist in all of this too, which needs to be looked at. And too much self-revelation can be a problem if not handled properly.
Yeah.
But let's put
Yeah.
that to the side, I think, and let's let's air our grievances about our clients first. Or at least those strange phone calls. One assumption which always gets me, and let's stick to the example I already threw out, the mother and the son. One example that always gets me is that by dropping him off, I am going to, this a change will happen.
Mm.
And this guy, in my case, because I'm a guy, is going to straighten my kid out.
Mm.
It's going to get him to what is it? Straighten up and fly right. Um, and not that's rarely sufficient to make therapy work.
Mm.
Especially for us marriage and family, a systems therapists, we are looking at what role mom is playing. We are looking at what role the broader community is playing in this person's life, and what role this person is taking in those different contexts. And there is and I have to have this pep talk with teenagers all the time, is there is, something, to the notion that if I change a little bit, eventually the things around me will change. And there is truth to that.
Yeah.
But in a lot of cases, a lot better change and a lot quicker change perhaps takes place when everybody in the system is looking to grow up or what have you, make a healthy adaptation. So that's the first one, is that by simply dropping my kid off, and I guess really we haven't even gotten to the client here and the assumptions the client makes. We're getting to the assumptions a lot of parents make, or caretakers or what have you, that simply by dropping him off and not engaging with him outside of the sessions,
Mm-hmm.
change is going to take place. And as often happens in couples therapy, the assumption is that they're the one who has to change, not me, not, not the system, not the whatever. The only problem here is the dude sitting on the couch. And
Yeah, you kind of,
where's the whole truth?
yeah, I think the person we see the most is the identified patient of the family, right? Probably the black sheep is, Timmy is causing the problems, so he's the one who's going to get to go to therapy.
Yes.
Right. And not that individual therapy doesn't work, but yeah, you're right. There's something to there's the dynamic playing out. There are relationships that are influencing things, and that this person is not behaving how they're behaving inside a vacuum or a bubble, right? That there are definite things pushing on them. So yeah, I think that's a big assumption that parents make, is because we both see a lot of teens, parents can drop off their teen and think, okay, well, this is what he is doing wrong or struggling with, and I'm gonna wait outside. And it can be harder to work with the parents, because there's kind of that mindset shift that, hey, this isn't just your teen. And some parents are very good about like recognizing, oh, you know what, I think this is impacting him. I think this is what is happening in our family is kind of, influencing this type of behavior. But sometimes it's really hard. It's kind of like a after school program. I'll drop him off. He'll be fathered or fixed, and then I'll pick him up in 45 minutes. So that's a big one. That's hard.
That is a big one. And it's interesting you talk about, there are parents who are sensitive to the need to change the way that they are parenting a teenager.
Mm-hmm.
And there are a lot of kind of impediments to executing that realization. One of which is, especially with, it seems to me, with larger families, which I have a fair number of, or at least members of, in my practice. One difficulty is that there are still lots of little kids in the house. And so one style of parenting is still quite appropriate to the vast majority of the people in the home. And then these ones at the top, I've never met an oldest child who at some point didn't get an apology from their parents because they didn't know what they were doing, that first time around. So there is this difficulty with learning a new style of parenting a quasi-autonomous, mildly intelligent teenager.
Yeah.
And it's interesting because I think societally, this is a relatively new problem, because my favorite example when I think about this is the book Johnny Tremain, because it's a relatively historically accurate book. The boy described in there is relatively typical of his time. And we're talking about a 13-year-old who basically is a small business owner and already has a marriage proposal and is it is more integrated into adult society than most 30-year-olds I know. So, I mean, yeah, and the point of the book is that all that falls apart and then he has to rebuild it. But he rebuilds it before he's 18, and we're dealing with 20-year-olds who can't even get out of their house. And not to denigrate that, because there are reasons for that, of
Yeah.
course, but
Yeah.
it's an interesting thing. I think it's fair to say that this problem of trying to figure out how to parent a teenager is a relatively new problem.
Yeah. True. Yeah, and I think part of part of the problem that I see working with teens a lot of time is the role of the father, and that might be something special to us as male therapists, but because it's coming up, I think it's worth mentioning that there is kind of a tendency, especially for families where the father is not in the household or not involved, that there can be an assumption or a temptation to say he's going to go to a male therapist, he needs the male model, and this therapist is going to teach him how to be a man, right? um, and we can't replace fathers. That's not our job. That's not our role. But there is something to, especially young people. I guess it's not just fathers too, but young people having a space to talk about thoughts and feelings, and to learn that, hey, this is worth looking at, and this is worth exploring. That can often be missed in the household. And even families where the dad is physically present, a lot of times the dad isn't emotionally present. And so I see a lot of that going on. And it's not all bad, it's not all good. There's benefits to it, and there could be a reliance on it too much, but I'd say it's a big factor. And I don't know if you've seen that as well.
No, no, precisely. The therapeutic relationship is insufficient to replace
Mm-hmm.
the paternal relationship or even the maternal relationship. Now, it's a interesting question, because there's two thoughts that come to my mind. The first is that there is a clear need for what's the popular phrase? Allo parenting. So where external members of the family engage in a quasi-parental role over this in this person's life. And that role, it seems to me, is designed to help that person, the teenager in this case, confirm much of what they've been taught in the home, or to edit and correct what they've been taught in the home, such that, following Erickson, they can enter society in a mildly productive way, engage with other people in a way that is a synthesis of the household rules and the societal rules. And I think allo parents do, and in addition to supplementing or providing some of that paternal guidance, in my case, paternal guidance that a dad should provide if a dad is missing, from the picture, and for whatever reason, or in whatever, whether he's physically present and emotionally absent or what have you. There is a place for that, but it seems to me the therapeutic relationship, well, just the amount of time is insufficient, to say nothing of
Yeah.
the strictures that go into the type of relationship. I mean, so assuming I'm right, that part of the allo parent role is to help provide an example of how to live in society.
Mm-hmm.
My clients don't get much of an example of how I live in society by
No.
design. By design, they're
True.
not supposed
Yeah.
to.
Yeah.
I mean, I'm a little more public because I'm online, and a lot of people come from various parishes I go to.
Yeah.
But look, even people who know me, I mean, I'm a reserved guy, and aside from the occasional political post on Facebook, you don't know much about me.
Yeah.
So, all right, so don't go on the ramp. Don't go on a search, please, because I don't really want to know what you
Lock
find.
down those privacy settings right now.
But my point is that yes, we provide a safe place to explore emotions, behaviors, and thoughts
Yeah.
for a limited period of time on a weekly basis, and that's just insufficient to
True.
for me to take the place of this kid's dad. That's just
Yeah.
insufficient.
Yeah, absolutely. And I guess, we probably do model permission for those things just by asking certain questions, right? Sometimes I ask questions, people are like, "Oh, what do you mean?" Like, "Oh," and they're kind of intrigued by that. I can tell that they haven't been asked that before. So I think, yeah, we don't have that example of our own lives in therapy, right? There's not much witnessing going on. There really shouldn't be too much. Um, but yeah, sometimes it's just allowing and giving permission to explore certain things in therapy, even if that's just our prompting or just giving them space to talk. But I think another assumption that kind of goes along with what you're saying about the limited time is that um, I've experienced clients that come into therapy with the idea that therapy is kind of like a medical checkup, right? That it's a quick fix, or it's just, oh, we'll just check back in every once in a while. Um, it's like, oh, they're going through a hard time. Let's just do a session here. We'll 3 months, and there is some frustration with that as a therapist, because I mean, just first of all, it takes time to get to know a client. It's 45 minutes. You're not going to dive into, what's going on in their life really, really well. There's a level of just building rapport and understanding who they are and what's going on. Um, and, the other fact is that 3 months going by or 1 month going by is you forget stuff and they forget stuff. And usually 45 minutes is not going to build tools and build enough reflection to have someone change for the next 3 months. So I always recommend that when people first come in, let's try to do once a week for at least a month, and then kind of evaluate and see where things are going. But I find that a challenge too. People kind of want spread it out and and make it kind of sporadic.
Yes, so we could put that as number two or three reason why therapy doesn't work is the frequency of therapy that people are willing to enter into. And I know this one therapist, he was one of my teachers in college, actually, I think, and or at the grad school. And he does one session every day for 7 days as his initial, yeah, as his initial way of getting to know the client. And it's, I mean, if you're willing to write that check, awesome. Or spread that payment over time or something, awesome. And that's kind of the extreme version of what we're talking about here. But I think, there's something attractive to that,
Yeah.
I don't know how comfortable I would be doing that, but I
Do
think
you
it would be a
work in
good thing
weekends?
for both of us. It would establish a relationship.
Yeah. Yeah.
Because one of the things that happens in over the course of therapy is that the client does begin to get these little glimmers of me. Everything from I once had a client try to have a full conversation about why my dress shoes were scuffed. And is it because I walked to work? Is it because I hit it on the car? What did I? Am I just lazy and don't polish it? Which is very true. And it's a combination of all those things. But they were intensely fixated on this one
Wow.
detail, and they did that in every session. Picked a detail and really honed in on what that meant about me.
Wow.
Uh, but it's an interesting thing that if a client doesn't first have a relationship with us, then therapy doesn't take place.
Hmm.
There can be an exchange of maybe tools, a kind of answering of a particular problem and providing you a resource that works for most people,
Hmm.
but you can get that on a call-in talk show.
Yeah.
I mean, write a letter to Andrew Clavin and you'll get practically the same advice, that you would get in that context. Um, so that's different than therapy.
Hmm.
And so if people aren't willing to have a relationship with us, and it's an interesting thing, and it's worth exploring with the client actually. So make the observation that, look, it seems to me like, I don't know what the nice way to say this is, you're having a difficult time um, having a relationship, or it seems to me you're distant or not fully present in this process, or some variation on that, which,
Yeah.
you know, and see what they say. I mean, there isn't a millennial I've ever had walk through my office who didn't at some point talk about how difficult it is to have a relationship, to
Mm.
make friends, to talk to somebody, to look them in the eye, to, all the rest of it. So,
Yeah. True.
yeah.
And that might go into the next, I guess, assumption is, that therapy is advice giving, right? That's our role, is to, let's hear about your life and I'll tell you what to do right and what to change. So how do you think that looks when, I guess what are the main differences you see between, let's say, counseling or therapy?
Well, or between life coaching and therapy,
Ooh, yeah,
which is both of which I engage in, um,
yeah,
because I treat life coaching as a much more solution oriented, where we outline the problem as quick as possible and we find a solution. And if that doesn't work, we grab another one and we apply it or we
yeah,
modify it. And it's rarely, the other distinction I would make there is that it's rarely focused on the emotional
mm,
component of a client's life. Now, that's not always true, but um, it is often true that you're focused almost strictly on a behavioral phenomena in a
yeah,
client's life. Now, and that's not always true because people are a big package, of course. And it's interesting if you talk to financial advisors, which is an intensely behaviorally focused activity, advising someone what to do with their money. There is the good financial advisors will always be sensitive to their clients' emotions
yeah,
surrounding money.
yeah.
I mean, what's Dave Ramsey's big phrase?
You
Debt
should,
is not a math problem; it's a heart problem, or something like
yeah.
that.
And he says
Um,
you should feel it. You should hurt when you give your money away, right? That's why he's against credit cards and stuff. He wants you to feel the pain of handing someone cash. Like, oh, there it goes. So that's very
I
true.
need to do that. I need to do that. Anyhow, if you want to find my Patreon page, we'll put a link below, by the way. But that being said, no, the difficulty that clients have with um, engaging in a relationship can be very much part of the therapeutic process, and indeed, on some level, simply building a relationship with someone
Mm, yeah,
is a can be in and of itself very therapeutic,
yeah.
irrespective of the problem.
Hmm.
Um, and so, yeah, when people have the assumption that they're there to make or to simply take our advice,
Hmm.
sometimes that works, but it never successfully addresses the emotional paradigms going on in a person's life.
Hmm. Yeah,
It it can address discrete problems in the present,
yeah,
but it's never going to take a look at what got you here. It's never going to achieve, I think, what Socrates would call, it's never going to achieve self-knowledge. It's
yeah.
strictly going to
True.
achieve a kind of concrete change. Um,
Hmm. Yeah, you might change the behavior, but you're going back to the same conflict, tension, dynamic, whatever it may be. You're not getting to the root of the problem or solving that right problem. So yeah, yeah, the relationship definitely is a strong tool. And I think in our modern age, where more and more people are feeling disconnected because of technology, they feel more awkward because of technology because they don't know how to do the face to face. And so part of using the relationship, the therapeutic relationship as a tool is there's just some sort of comfort and be like, oh, I can talk to people. I can be vulnerable with people and this isn't weird, or this person isn't judging me. And so that can be a really hopeful encounter as well, to say, wow, I can talk with somebody and not be judged or not feel ashamed. And yeah, that's pretty powerful. I think about that. I'm like, wow, yeah,
It is
that's
very
nice.
powerful. And another element of that, which I think is, if done correctly by the therapist, can also be very powerful,
Hmm.
is that experience of being able to sit in a room with somebody who holds slightly different opinions.
Yeah.
And that's a delicate one, because the therapist does have to be careful about what he or what I divulge. But it's an important experience that our technological society, our social media society, does not um, occasion or offer people very, very frequently, because we are able to curate our Facebook feed, our Instagram feed. I mean, if I want to simply talk to people who have beagle dogs, then I can do that. If I want to only talk to people of a particular political opinion, I can do that.
Mm.
Which to me is intensely frankly, anti-family on some level, anti-city on another. I mean, some of the greatest historical events of the Middle Ages took place because cities were literally at war with each other. I mean, Dante would not be capable of populating his hell or his heaven if there wasn't two political parties in Italy that were fighting with each other. It just
Yeah.
would have been impossible for him. And probably, I mean, anyhow. So that's maybe a stretch of a reference, but there you go. So yeah, and I do think a therapist can offer their client that opportunity. Um, and there are kind of some very clear chances for a person to learn that kind of uh, emotional strength to be able to present their own opinion in the face of possible contradiction,
Hmm.
potential contradiction. There may or may not be contradiction. There may just be judgment, or there may be a kind of, mutual exchange of views. Um, but that's something which I've only ever kind of waded into after the relationship had been long and firmly established. But that is another opportunity that therapy provides, I think, for people, which our society does not provide with as much frequency as it once did.
Yeah.
So,
Yeah, I think what strikes me too is with social media, it's kind of this unfiltered, you know, opposition at times. And we can say, I don't want to see this. And we can unfriend people or unfollow pages and things like that. But in doing that, we're kind of getting a lower tolerance for ourselves to hear any opposition, right? It's like, yeah, it's good to not have to hear, what you disagree with 24/7 every time you open your phone, but we need some opposition, we need some tension to grow, and I think there's a lower tolerance of that in society, and therapy. I guess the difference between that and counseling is that unless you're Carl Rogers and you have that unconditional regard, you might be using that therapeutic relationship to say, it seems like it's really difficult for you, or like there's a lot of anger here, or that to point out the obstacles of the room for growth, and to even call a client to become better. That there can be, and especially that was hard for me starting out as a therapist, but there are times in therapy where I need to poke my clients and be like, hey, what's going on here? Like you're saying this and then you're doing this and it's not adding up. And that part, that accountability piece, but that you know yeah, that call to hire is really important. I think it's different from counseling, and like you said, it relies really on a heavy rapport and relationship where you can call people out and there's a level of trust there. But that is so important because as you know, consulting and seeing couples, I mean, there's a lot of pushing. There's a lot of pushing and
yeah.
awkward conversations, and as therapists, so that's super necessary to kind of Sometimes,
The
but
firmest and quickest response I ever got to the question, how could therapy have been better for you? So when I'm terminating with a client,
yeah.
um, was you could have challenged me more.
Mm,
And this client, he had it on the tip of his tongue, ready to go. He knew exactly what I wasn't providing that he
mm,
needed. And so that's something I've been sensitive to as well, and gets back to kind of the beginning of our conversation where we differentiated the role between a therapist and a parental, a
yeah.
paternal figure in a client's life. You know, especially for men. I don't know what it's like for women, other than what some of them have told me. But there does need to be this um, incremental challenge or call to greater perfection,
Mm,
to improvement in the various areas, domains of our life. And a therapist, I think, can, and I think often should provide that in clear terms.
mm,
Now, this is kind of anathema to the education I received, where therapy is strictly an experience of listening and reflecting the client's experience.
mhm.
And I wonder, and I would love to dig around a little bit and see if there isn't a study on this, but I wonder if that right there isn't the fundamental reason why so few men go to therapy.
Mm, mm,
I think my gut tells me that would be in the top three reasons why men don't go or persevere in therapy is because there is it's on some level it is simply or can devolve, I think, or simply become a exploration and reflection of what's taking place without any momentum for,
mhm.
without
Yeah.
any um, desire for improvement. And it's an interesting thing. I mean, guys want to get better at what they do, you know,
Mhm.
and they want to do the best they can. And if there isn't somebody challenging or prodding or pointing the way or helping them out,
Mm.
then that relationship, I think, loses a lot of value for guys, you know?
Yeah. True. Guys are tend to want to fix things more, right? You see that with couples. The
Well,
guys
and
are
it's
typically,
it's C.S. Lewis's image of friendship, right? Two people shoulder to shoulder advancing forward towards a
yeah.
common goal, you know? If you're gonna have a relationship with your therapist, it can't be, a perfect friendship
Mm,
because you can't know everything about each other, but it needs to be it needs to have that element of advancing towards a common
yeah.
goal.
Hmm.
If I think if guys are going to stay in therapy.
Yeah. And yeah, that's a good point. And sometimes I think with guys especially, it could be the reminder that reflecting on their current state or reflecting on something that has happened is pushing forward. That they could take it as like, well, I don't want to just go over the past over and over again, but that work to say this is worth looking at is taking it forward. It's like making meaning of our experiences and our past and trauma. It's that sometimes they need that reminder because they could feel like, okay, but what do I do next? Like, how do I make this better? And there's a line that's like, we're looking for an answer that God hasn't asked the question to yet, right? He hasn't asked of us to go forward in a way that maybe we're looking to go forward, but that we're asked to go forward by doing this introspective work or making meaning of things that have happened to us. And that can be hard too, because it doesn't feel like, well, it's not immediately getting better, but there is healing going on in there. So yeah, that can be hard too. I think there's a reminder needed that, hey, this is this is valuable. This is still a step in the right direction.
Well, and I mean, you describe it beautifully. It has to be that kind of exploration has to be contextualized as part of the process of moving forward, of part of the process of finding a solution. It cannot be, or I think therapy suffers when that becomes an end in itself, to simply engage in the
Mm-hmm.
exploration as an end in itself, rather than
Yeah.
as a part of the process of growth and improvement. And so that perhaps, I mean, we didn't articulate it as such, but that might be another assumption as to
Mm.
why therapy doesn't work.
Yeah.
People are they have what would be the right way to summarize the last 10 minutes? They have a false understanding or impression of the role of emotions in therapy,
Mm.
or the
Yeah.
place of emotions in a therapeutic relationship.
Hmm. Yeah. And you kind of see that across the board. Some people come into therapy thinking emotions are, the devil, and we just have to logically figure this out. And some people it's only emotions. So that's another challenge that varies pretty heavily. But yeah, that's an interesting thing to encounter is to see where people place emotions, because it's all over the board. It's like, do I just give into everything, or do I just push that down and never look at it, or
Yeah, right, right.
so there's a lot in the middle. But
My favorite image for emotions, and I think this comes out of Aristotle's Ethics. Um, I'm almost certain it does, but it's also present in Plato's Republic, and it's present, I think, a little bit in Thomas's St. Thomas's commentary on the Ethics. But the emotions and the memory and the intellect and the imagination and the will, they work like a city. They're all of the way to imagine these things is to imagine them like members of a city state. And I think Aristotle it is that has the line where the will is supposed to govern all of these, not like a tyrant, but like a polity, like a democratically elected leader
mm,
does. He
yeah,
sometimes has to listen to the voice of the cobblers union, so he has to sometimes listen to the voice of sorrow, or he has to sometimes listen to the soldiers, so he has to listen to fortitude, or he has to listen to what courage tells him to do.
mm,
Sometimes he has to listen to a different, the farmers, and so he has to, give in a little bit on temperance, but not too far. There's this listening to all the raucous noise of your emotions, and giving them, following them when they are in accord with right reason, when they are in accord with the proper measurement or rule.
yeah,
Then we give them voice. But the minute you let one of those the minute you let the farmers run into the city and burn all the other houses down, and all you have left are farmers, you don't have a city, and you have a smoldering ruin. So the analogy would be, the minute you let your desire for food take complete control of your life, the obvious problems
yeah,
that come with devoting your life strictly to food consumption.
mm-hmm.
Um,
And
so
creating an
yeah,
environment for
it's not about
that.
it's not about killing the various emotions.
Hmm.
It
Yeah,
is about listening and about deciding how far is it proper for me to let this voice rule
yeah,
the day.
yeah. That's a really great image. I love that, because farmers aren't bad, but if you let them rule and only include the needs of the farmers, then you don't have a healthy city, right? So yeah, that's a really great way to look at it.
Well, and that's why a healthy political system is important, because it does function as a externalization of my interior life,
Yeah.
or of a well-ordered interior life. So I think the interplay between your broader political system and your interior life is hardly even guessed at by most people, but I think it's an important meditation.
So
And it gets us a little far afield from why therapy doesn't work. Although I guess bringing up politics would be one reason therapy doesn't work. But anyways,
you
the
know that
example works.
modern politics probably reflects the inner life of man. So I think that's a worthy
Well,
conclusion.
what's the phrase? The parish gets the priest they deserve, the people get the president they deserve, I mean,
Yeah.
it's the often these things are a reflection of, oh, well, Jordan Peterson sums it up beautifully 1,000 times over. People tend to vote their temperament.
Yeah.
Your big five temperament, people with a high openness tend to vote
Mm.
liberal. People with a low, I can't even remember what it was, but lower on one of the other, or a high conscientiousness, that's it,
Mm.
tend to vote conservative. And
Yeah.
that's almost universally true.
Wow. And so I guess my last question before we wrap up, and this might kind of point to what therapy should look like, and or what we look for. But what would you say your ideal client is? Because I think it's easy to talk about what to look for in a therapist, which is helpful, but also what as a therapist, what is your ideal client?
Now, this is a very important question, not just for the therapists who listen to us, because every therapist does have to answer this at some point
Mm.
and pursue this kind of client at some point if they are going to be financially successful.
Yeah.
There's no way around it. And
Yeah.
not only financially successful, but unlike St. Paul, a therapist cannot be all things to all diagnoses. We, I got into this because I wanted to work with depression because I kind of sympathized with it. I kind of understood it. The desire to suicide makes a lot of sense to me on some level. And so it's like that's the people I wanted to work with. Now, since then, I've learned a lot about a lot of other things,
Hmm.
and I can help a lot of other people.
Yeah.
OCD being a great example. I had no desire to go anywhere near that, and half my clientele
Yeah.
have OCD.
Yeah.
So anyways, just to emphasize the importance of answering this question, not only for the therapist but also for the client, even to ask their therapist. You know, you don't want to be working with somebody who is not familiar with your needs,
Yeah.
at least in the broad general sense of the term.
Hmm.
So one of the problems, especially when you market yourself as a Catholic therapist, is that Catholicism is not yet a medically recognized diagnosis. I think we're moving there on some level, but more about that later, I suppose.
Yeah.
Uh,
Geez.
so by advertising as a Catholic, I'm not advertising to a diagnosis. And
Hmm.
so every diagnosis walks through the door because, unfortunately, by the grace of baptism, we're not immune to certain medical disorders, as delightful as that might be. So what happens is that I have to turn away some clients or refer them out,
Yeah.
and they don't get the glorious experience of sitting in the room with me,
Mm.
which would be a miserable experience for them because I'm
Yeah.
not competent. What's
Mm.
the legal phrase? My scope of practice or my scope of competence?
Yeah. Scope of, I think it's both. Yeah. Scope of practice, scope of competence.
Right. So I'm not competent to deal with everything.
Yeah.
Competent to deal with very few things. But to answer your question,
Yeah.
um, one issue which is particularly dear to my heart is the question of launching. So the question of moving out of a particular um, uh, uh, system into another. So the question of teens moving into college, college kids going into the workplace, building your own family, those kind of things. But also, and much more particularly, I positively love working with people who are engaged in some degree of discernment, whether it's
Mm.
into a religious community or out of a religious community or seminary, as the case may be. Now, this isn't necessarily a diagnosable issue. It's simply a occasion
Mm.
for um, for things like depression and anxiety to crop up.
Mm.
For it's certainly an occasion for the kind of coping mechanisms of an OCD person to manifest. So even still, I haven't quite narrowed down my ideal client to a
Yeah.
particular set of diagnoses. So I
Hmm.
do have to be a little bit of a jack of all trades when I advertise myself as somebody who is engaged in life transitions with people.
Hmm. Yeah.
Uh, so there's still a great deal of wiggle room there, but that's my ideal client is somebody who's really discerning what is of value to them and how
Hmm.
to maintain that, whether it's a behavior, a thought, an emotion, a belief, and to maintain that in a new system.
Mm.
So I don't know if that
Okay.
makes sense, but
Yeah. So a lot of life transitions, big changes, kind of discerning where the value is, where the purpose is, and within what's going on in their life.
yeah.
That's
How
good
about
to know.
yourself? What's your ideal client? What do you look for?
Um, I think the first thing is that they are motivated to do their own work. Just because I've sat with a lot of teens that are forced to be there, and it's like, okay, well, what do you want to do for the next 40 minutes? Because you don't want to do this. So, but yeah, having clients that are willing to look at what's going on, that want to see a change, and I see the clients that come in and they say, okay, Adam, this is what's going on in my life. I want to be open and honest with you. I want to make these changes. They are by far the most successful clients I have. And the best relationships I've been able to build in therapy are the ones who are like, you know, this is me. This is on me. And as a youth minister, I say on retreats, I say you're only going to get out of this retreat what you put into this retreat. And I tell my clients that starting out in therapy. So you're only going to get out of this what you put into that, because it's not a magic pill, and it's not a quick fix. So I think for the first thing for me, it's just that they're motivated, they're willing to go there to be open and honest, not just with me, but with themselves to look at what's going on. So that's by far, I think, the biggest factor. And then I think the second one would probably be that they are looking to incorporate faith into the picture, as kind of not just an I don't know, not just an avenue, but for us to really get down to what matters, right? It's, when you're talking about purpose and what they value and things like that, there's kind of an obstacle from my perspective of, if a client doesn't know what they believe, or hasn't really gone there, or is afraid to go there, it does make it harder sometimes to discuss even the most basic things, right? And therapy is part of that process, but being able to have faith in the room, or at least explore that, right? Not that they, like, I believe this, and this, not always the case, but to be able to bring that into the room, a client who is willing to ask those big questions, I feel really helps the therapeutic process, because they're not afraid to go into, dive in head first. So those two things are really, I'd say, my main things, that they're motivated, and that they're not afraid to ask those big questions about life, purpose, death, faith, suffering, all that good stuff. Um, and for my specialty, I really enjoy working with teens, because I think a lot of that exploration is happening in those teenage years, those young adult years. You see a lot of that. So I love working with that. And I think, as far as a diagnosis, I really like working with people with anxiety. And I didn't think I would like working with people with OCD and scrupulosity, but now that it's also become a big part of my practice, I'm actually really enjoying it. And it's help kind of find that peace with clients when they are getting lost in their own thoughts and anxiety, and images of God comes up a lot, and faulty images of God, and then family. So all that stuff I really like looking at. So yeah, that's kind of a lot in there, but
Well, I love your focusing in on making one's relationship with God part of the therapeutic relationship. And it's an interesting thing because, so I had theological training long before I had psychological training. Maybe I had that backwards, but whatever. Maybe that was why I didn't persevere. But but the point is, for why I bring that up, is that what is it one of the Teresa's? I think it's Mother Teresa, who says something along the lines of prayer or meditation is what a conscious relationship or conversation with someone who loves you, or I butchered that terribly, but the point is that it's a relationship, and we as systems, therapists who seek to help clients change, using their various relationships. It seems to me, at least on some concrete, practical level, the relationship with God is a huge part of that for any person, whether atheist or not. I mean, if you're denying that somebody exists, or aren't even aware that he exists, there's a kind of relationship there in some tangent, in some extended definition of that word. But yeah, it's an interesting thing. I'm not there to be a catechist or a theologian with my clients. If you want that, you can go to my website, but I'm not there to do that as a therapist. What I do think is very much part of my what I am allowed to talk about in therapy and use in a therapeutic context is how this person goes about expressing or engaging in a relationship with the divine, whether that's Lectio or whether that's meditation, whether that's an examination of conscience, the rosary, attending liturgy, whatever that looks like. And at least in a therapeutic context, that is a very open-ended and broad discussion. But I think that's an extremely, well, as you say, extremely essential part of any change in a person's life.
Yeah. That might be a whole nother video to explore, but I think, the idea that the more we know God, the more we will know about ourselves, right? That our faith really screams that at us, that we become freer, we become more of ourselves when we lean into Christ and encounter God in that way. So there's definitely something to Catholic therapy, right, versus secular therapy, because we're seeing the whole person, and we're seeing everything, in the context of our sonship or daughtership in God. So it is really important. And I know kind of have to wrap up here in a second, but this is a really good conversation, and I think there's a lot of maybe what we're talking about as the ideal client is probably reveals kind of what would hopefully be a good therapist as well, if we kind of flip that on its head and say, we have to be motivated, we have to be looking at our own prayer life, we have to do our own work, and we have to be empathetic in checking these things. So but good
Well,
stuff.
let that evil be sufficient for the day, and maybe a great opportunity for those who are watching. Put a comment below. Go to my website, fill out a comment if you've got a question. If you've got a topic you want us to explore, let us know, and that will help us, first of all, deliver what you're interested in. But second of all, these conversations are kind of freewheeling, and the more we can be directed in at least the beginning of our conversation, the better. So let us know what you guys want to hear about.
Yeah, and thank you for watching, and we'll have some more of this in the future. Cool. All right. God bless.
You too, man. God bless.